Good afternoon, everyone, and welcome to today's webinar. We're going to get started in just a minute. We're going to let folks get onto the line, get their audio connected, so hold tight. Good afternoon, everyone. Thanks for joining. This is the Leadership Checkup Series hosted by the National Council for Behavioral Health and the Association of State and Territorial Health Officials. Before we get started, I'd like to quickly run through a few housekeeping notes. To access audio for today's presentation, you can listen through your computer speakers by joining the Join with Computer Audio option in your Zoom window, or join by phone by dialing the number shown on your screen. Upon entering, you will be automatically muted. Please keep yourself muted for the duration of the webinar. We'll have time for questions at the end, so feel free to use the Q&A box located at the bottom of your screen to share any questions you may have throughout the presentation. And finally, today's webinar is being recorded and will be archived for future viewing on the National Council and ASTHO's websites. The link to the archive will be sent out to you following this webinar. The Leadership Checkup Series is a collaboration between ASTHO and the National Council's Behavioral Health Training Institute for Public Health Officials, designed to support state, local, tribal, and territorial health officials through this unprecedented public health crisis. The goals of the Behavioral Health Training Institute are to increase the knowledge, skills, and abilities of public health practitioners and workforce to improve and enhance behavioral health strategies within public health settings. Today's presentation, titled "What Can We Learn from Crisis? Leadership, Post-Traumatic Growth, and COVID-19," is presented by Dr. Joe Parks, Medical Director and Vice President of Practice Improvement, and Lisa Guroff, Director of Trauma-Informed Services at the National Council for Behavioral Health. Joe is a member of the National Council's Integration Consulting Team and brings an unequaled depth of experience to his clients, ranging from implementing evidence-based medicine and data-driven care to pharmacy quality improvement and utilization management to value-based purchasing and healthcare policy. He is also the power behind the National Council's Medical Director Institute and has proven leadership through his work as the former Chief Clinical Officer at the Missouri Department of Mental Health. Lisa has over 25 years of experience in the behavioral health field, providing direct clinical services, clinical supervision, and administrative direction. She has worked in a range of clinical settings, from treatment foster care to outpatient mental health to a variety of residential settings for children and adults. Prior to joining the National Council, Lisa was the COO of a large mental health provider where she oversaw and directed the implementation of trauma-informed care practices across the agency. At this point, I'd like to turn it over to Ava Mason, Senior Director of Leadership and Learning at ASTHO, to provide some opening remarks. Ava.
Thank you so much, Casey. It is my great honor to welcome you to today's session. ASTHO is so pleased to work with the National Council for Behavioral Health to provide this Leadership Checkup Series as an opportunity for public health professionals at the local, state, and federal level to better understand the impact of the stress and anxiety that we are all experiencing during this time. We hope that you can use the session today to identify a few core components of trauma-informed leadership and post-traumatic growth. While many of you have been on the front lines with COVID since March, facing and experiencing a large range of emotions and increased anxiety, we hope that these sessions provide just a moment for you to pause, reflect, and plan a path forward. As our nation is experiencing a collective traumatic event, it is extremely important for us to individually consider how we each can manage this time to hopefully emerge from this crisis in the best way possible. We are so excited to hear from Dr. Joe Parks, the Medical Director of the National Council for Behavioral Health, and Lisa Guroff. These two are phenomenal experts in integrated services, trauma-informed care, and resilience. And our previous sessions have been a great success. So I hope that you find today's session both informative and immediately useful for you. So I'm now going to turn it over to our speaker for the hour and hope you have a great rest of the day.
Thank you, Eva. And thank you for having us join you today. And thank you for the work you do. Thank you for being out there trying to help people every day. I wanted to start with a little meditative moment. We do that a lot in our work, especially around trauma. And this is a quote from Viktor Frankl, a very famous psychoanalyst who survived the concentration camps in Nazi Germany. And his quote is, "What is to give light must endure burning." And he went through horrible trauma. It's like, and this makes me think of, you know, what is burning? Something is lost, the thing that is burned. And it's about change. And then it's about something else coming out. It's loss and change and something else coming out. And that actually reminds me of a fairy tale, because fairy tales are also about loss, and they're about change, and they're about something else coming out. And the one I'm thinking of is Iron John, an old German fairy tale.
Hey, Joe, sorry to interrupt you, but it seems like there's some static. Could you maybe adjust your microphone?
Oh, I'm sorry. Is that any better? Am I coming out any clearer?
Yes, that is better.
Okay, very good. Okay, so this is an old German fairy tale, and like all, it starts out, there was once a king, and in his castle's courtyard, he had a naked man with iron-like skin, long, shaggy hair all over his body. He was locked in the cage in the courtyard as a curiosity, and no one was allowed to set him free or they would face the penalty of death. So one day, the young prince of the kingdom was playing with a ball in the courtyard, and he accidentally rolls it into the cage, where the wild iron-skinned man picks it up and will only return it if he's set free. And he tells the young prince that the only key to the cage is hidden beneath the queen's pillow in her bedchamber. So the prince hesitates at first. He's scared. He knows it's wrong, but he eventually builds up the courage to sneak into his mother's room and steal the key. And he releases the iron-skinned man, who reveals his name to be Iron John. The prince fears he'll be killed for setting Iron John free, because that was the penalty the king, his father, had set. So Iron John agrees to take the prince with him, and they leave into the forest. So it turns out that Iron John is a very powerful being. He's not just a regular man. And he has many treasures that he guards. He sets the prince to watch over a deep well in the forest, but warns him not to let anything touch or fall in it, because it will instantly turn to gold. Well, the prince obeys at first, but being a young man, he of course begins to play in the well anyway, and ends up first turning his hair and then his thumb into gold. And Iron John is disappointed. He's angry at the boy's failure to follow the rules, and he sends him away to experience poverty. And he has to struggle alone, and he goes on a long journey. And Iron John tells the prince that if he ever needs anything, though, he should call out his name, but he must leave now because he's disobeyed. So the prince travels to distances, and he offers his services to a new king he finds. But he's ashamed of his golden hair. He has this mark of disobedience, and he refuses to remove his cap before the king, and the king is insulted. So instead of being helped, he's put to work as a gardener, and he has to work in the dirt, and he has to labor. And then a war comes to the kingdom, and the prince sees his chance to make a name for himself, to regain honor. And he calls on Iron John, and Iron John appears and gives him a horse and armor and a legion of fighters to fight with him. Well, he successfully defends and wins the battle, and he returns all he was borrowed, the warriors and the armor, and returns to the king. And in celebration, the king announces a banquet and offers his daughter's hand in marriage to any one of the knights who can catch a golden apple that must be thrown in their midst. The king hopes that the mysterious knight who saved the kingdom, because he doesn't know who he is, will show himself to get the prize. And again, the prince asks Iron John for help, and he disguises the prince as a mysterious knight. And 3 times he appears and catches the apple and escapes again. But then finally he's chased into the woods and brought back and revealed to be the lost prince. So he returns to his former station. He marries the princess, he's reunited with his parents. Iron John comes to the wedding, but this time Iron John is different. He doesn't have shaggy hair or iron skin. He's no longer frightening. He too was under enchantment until he found someone worthy and pure of heart to set him free. That's my fairy tale, and we'll talk more about it and what it can teach us about trauma and different ways we respond to trauma. I'd like to turn it over to my close colleague, Dr. Guroff.
Thank you, Joe. So as we also like to do for those who have been joining us in this series, is it's really important that we're really intentional about our time. And there is so much going on in our world, in our homes, wherever you're reporting from today. And so I'd like you to take a minute and kind of set your intention for the next 90 minutes or the next hour while you're with us. What do you need to give yourself permission to do? Is it to turn off email? Is it to respond to your kids if who might be at home studying? Or is it to say it's okay not to respond to them? Is it okay for you to give yourself permission to stand up and stretch as you share and listen to this information, or to step outside? What is it that you need to do for you so that you can be fully present over the next hour to really engage with the information that we're sharing? And as we have done in the last couple times, if you guys can take a moment, write that down for yourself, just so you can be focused on it, remind yourself of that, but then also share that with us in the chat box so we can see what you guys are doing for yourselves over the next hour to stay present and engaged. So open minds and not responding to emails, taking the time, not multitask. Permission to let other supervisors handle things, putting the phone away. Permission to focus on one thing, to feel relaxed. A lot of putting things off, recognizing that they'll be there, turning away from the kids, who are knocking on the door. For those who have heard me speak before, have joined me before, you know that I also have kids at home. And there's not always that separation sometimes. The forgiving, what was when you guys are going quick here. Listening to one's body, putting aside time afterwards to focus on work, forgiving one's expectations so that you can relax and let go, shutting the door, turning the lights off. That's great. Well, Joe, I think we are ready to move into the information for today. Casey, there we go. So our learning objectives today are to really focus on what is trauma-informed resilience-oriented leadership and post-traumatic growth, and recognize how we can use the pace right now of rapid cycle change management to enhance staff performance, engagement of trauma-informed care resilience-oriented principles, and really improve both client and staff engagement as we go forward. So I'm going to hand it back to Dr. Parks.
So what are some of the benefits of adopting trauma-informed approaches? Well, it increases safety for everyone. It improves the social environment. It'll be a nicer place to work together. And it takes care of the caregivers, because you can't care for others unless you take care of yourself. It'll improve the quality of your services, and it'll increase hope, which leads to healing and recovery. It'll make you more successful. And it's good to be a smart organization, but it's more important to be a healthy organization. And in the end, it'll help the bottom line too, because you'll be less impaired and better able to function. Next slide. So I think I'd like to ask Elizabeth now to lead us in this reflection of yourself as a leader during COVID. Elizabeth? Liz?
Thank you. So we shared with you a piece of this in our last webinar, and really kind of how do you start to look at this as a post-traumatic growth opportunity? How do we move forward as a leader? And one of them is really making sure that we can write down, honor, and be able to find a way to come back to and reflect on all of the incredible things that you guys have been doing, right? All the pivots you guys have made over the last 6 months, right? So the first question we have for you is, and again, if you can share with us in the chat box, what are your successes so far as a leader during COVID-19? What are some things, some really cool things that you have been able to lean into and results that you have had in your leadership roles?
I'm seeing some pretty good ones here. Being present for others, creating a safe space, statewide team building, never done before. It's amazing what a challenge will do for people. Adapting to change. A lot of courage is a lack of choice. Whoa, they're coming so fast I can't read them. This is an active group. I love it. Self-care. I saw self-care in there for a minute. Supporting employee families. Finding humor. Humor's a big one. Handling hurricanes. More out there going on than just epidemics. Wow. Implementing boundaries, maintaining flexibilities, staying calm.
That's a huge one. It's so important during this time, as you guys have been with us, that need, right, to regulate so we can regulate our staff. Those are great things. Okay, let's turn to the second question. Looking back so far in the last 6 months, if you could alter how you did something, what would you alter?
Take better care of yourself. Always a good idea. Time management. Being more compassionate. There's things about trauma that teach us about compassion. Give myself forgiveness. Less judgmental about other people's stressors.
So a lot of self-reflection in those. So what about this second one, or this third one, I'm sorry.
Mm-hmm.
What wouldn't you do? What, in looking back over the last 6 months, are your ouches, are your, oh, I would never do this again?
I think this is the burning part that Viktor Frankl talked about.
Yeah. I see buying into fears and the anxiety.
Shame, I saw. Shame's a killer.
That's a hard one.
Isolating is a killer.
Yeah.
Doom scrolling. I hadn't heard that that phrase before, but I get it.
So in their policy, choosing policy over ethics.
I thought it's not a race, but a marathon. Endurance is important.
So I see a lot of really being mindful, right, about how we're responding in this crisis and during this time of complex trauma. Self-doubt.
Mm-hmm.
So what about this fourth question? What would you do? Looking back over the last 6 months, what? I saw that one too.
Yeah, from your lips to God's ears for me. Journal.
Journal more. What'd you say?
You know, Viktor Frankl wrote an entire treatise on trauma while he was in the concentration camp. How's that for journaling?
Yeah. Walk more, stop rushing. So thank you guys. Definitely, I see a lot of great ideas to take forward, a lot of really creative things that people have done to flex, you know, those muscles, our creativity as you guys as leaders transitioned, like on a dime, right? It was like, tomorrow we're doing this. And I also see the need for self-care and to recognize that everyone is doing the best they can with what they have in the moment. And that when we can, even though we can learn, and Joe's going to talk a lot about that today, you're doing the best you can with where you are. And so please make sure that you take time to honor that. And if there's something I could do with that shame, you know, I would take it away for you guys. We are all, you know, doing what we can. Celebrate strengths. Absolutely, Liam. Thank you. And then our last question. So a year from now, what do you still want to be doing that you are doing today?
Outreach. Helping others. Being grateful. Gratitude is a healer. Creating art.
I saw do you think taking a real lunch break and going for a walk? Any others that stand out to you, Joe?
I saw journaling again. I saw a couple on art. Being more confident. You know, self-doubt is a problem, and there's things about going through hard times that make us more confident out the other side. Yoga.
Saw a couple people wanting to still telecommute.
Acupuncture.
Family meals, huge protective factor for our kids. And stress reducer for us.
And Lord knows we've had a lot more opportunity for family meals.
Yeah, yeah. So these are questions that we're gonna go over again at the end. But what I'd like to point you to is this is a great method for rapid cycle CQI, excuse me. And we're going to talk about that at the end of this as well. And these are some of the journal prompts, not all of them, but some of the journal prompts that we gave you last time. So I would definitely encourage you, whatever you shared with us in the chat box, get down in your notes so you don't lose that, and then can continue to grow those lists for the 4 questions. And then also, you know, what do you want to make sure, so you can look back and make sure you are still doing whatever was on your still do list.
Okay, so crisis. This is the reminder to us that in Chinese, crisis means danger and opportunity. And in your responses, you found a lot of opportunity. I saw some great opportunities in a wide range there. We'll go ahead. And trauma is like that. You know, trauma gives us an opportunity for growth and strength, to find new beliefs, new ways of thinking. It changes us, like the burning changes the wood into light. And it gives us an opportunity for resilience. We can only, you know, much of courage is lack of choice. And I'm sure many of you found that you were braver and more resilient than you thought you might have been had you been described your circumstances. Let me go back to the fairy tale. We'll go to the next slide. You know, the fairy tale, I told you, actually, if you're interested, there's an entire book that's an exegesis on it. It is an actual...
Joe, you're staticky again. Sorry. You're a little staticky again.
Yeah, I'll go. I'm leaning into my speaker. This is about as close as I can get.
Okay, great.
We'll go to the next slide. So it's really, fairy tales are a lot about post-traumatic growth. They all follow the same motif. And they really were an early study, giving case studies of how to handle trauma. In other words, you know, post-traumatic growth doesn't happen naturally. We kind of have to be trained. And this is really a Jungian approach. Jung said that we learn and our psychology is built around old myths, images we have that we apply to other things. And here's another book you can read if you're interested in this way of thinking about psychology and trauma. But Campbell surveyed many cultures, their rituals and their myths, and came up really with this model of the quest of a hero as a model for growth, as a way of facing our fears, dealing with traumas, and figuring out how to use them to gain strength rather than remain injured and impaired. Go ahead. So they all have the same basic structure. They all start once upon a time when everything's normal, and then there's a wound. A loss or a threat occurs. You know, the old parents can't feed their kids. There's a dragon. You know, you broke the rules and you have to go into the forest, which is the retreat. The protagonist, once injured, they get their wound, they usually retreat. They go off, they're lost, bewildered, they need some time to gather themselves and get recuperation. And then they gather resources. Usually, often they meet people they didn't know before. They find things they didn't know before. And then they change. They utilize these resources to go back and reface the challenge as a different person, with new weapons, new strengths, new ways to approach it. And they return home, and in the end, it transforms them. They're able, but they have this process of retreat. You know, if you look at some of the studies done after 9/11, in the first 5 days, 80% of the people met criteria for PTSD. But later on, only about 20% actually had PTSD. There's this normal phase of feeling impaired that often, more commonly than not, most people facing trauma do not end up with post-traumatic stress disorder or permanent damage. Most end up changed and stronger. Go ahead. Some examples in other fairy tales. Lizard Goodbye, love it. She loses her home. She's in a cyclone. She finds some other resources. A whole bunch of guys out there, kind of wild men, who help her face, you know, who help her with her journey and help her endure. Cinderella, no fault of her own. Bad mother, has to endure also. There's always this period of wandering, of enduring, of following the loss. Go ahead. So here's the quiz. What do a victim and a hero have in common? And the next slide is the answer. Both have been wounded. I really think of our wounds, our traumas, as a question that is asked to us. That hurt I had asked me, what now? What will you make of me? What will you do with this? And our wounds really can make us more human, more compassionate. So many of you mentioned gratitude. Our wounds can make us stronger and help us grow up and be adults. There's an old saying, one quote from the Iliad, the old story by Homer of the war before Troy. As Achilles at one point says, the gods envy mortals. And it's because we can be wounded and we can die, which means we can change. The gods really, as immortal and unable of being harmed, act like little ungrown-up children. So this is part of how I would urge you to think about what you've been through and the phase of where you are. You've endured some burning, and you've learned some things, and you've had some courage you didn't know you had, and you found resources you didn't know you had. And a lot of the way, part of the way to take care of yourselves and others is to not deny the burning, but also turn to the learning. You know, what am I going to do different? What can I do the same? What do I want to keep on doing? What did I have to do different that I never want to give up now? I think that's what myths and fairy tales can teach us about trauma and how to think about wounds and trauma in kind of a more nuanced way. Next slide. So over to you, Liz. Well, I'll go on ahead then, since.
Sorry about that. I was on mute. Turned on my camera, but not the mic. So, you know, it's really important that we understand that trauma is this human experience, something that we all go through. It's not something specific to a group of people, them over there, but just to everyone. And so when we start to build a trauma-informed, resilience-oriented organization, this is our culture. This is the way that we respond to everyone. From SAMHSA, we're going to go over SAMHSA's principles today, as well as their 4 R's. So in SAMHSA's 4 R's, we realize the widespread impact. And as you can see, this is your program, your organization, your system, right? We realize the impact of trauma and understand the path for recovery. We recognize signs and symptoms of trauma in our staff, in our clients, in our families, in any human that comes and interacts with us in our system. We resist re-traumatization. In other words, we create a healing environment for everyone. And then we respond in a way that fully integrates all of that knowledge into both about trauma and resilience, into our policies, procedures, practices, and our settings. So what does that look like? When we become a trauma-informed organization, we create, Casey, the next slide, this safe, calm environment that's supportive to all. We have this system-wide understanding of trauma and its prevalence, both, as I said, in primary trauma, secondary trauma, compassion fatigue and burnout, all the different ways in which it shows up in our system, cultural competence and our humility in terms of our practices. In other words, we're not just recognizing someone else's culture, but we're recognizing our own perspective. And we are recognizing the way in which that perspective impacts how we interact with others. And we start to approach things from a humble place. We include client voice and choice and advocacy in everything that we're doing. We're oriented to recovery and consumer-driven care and services. And we really focus on these healing, hopeful, honest, and trusting relationships with all humans, because what we recognize is that trauma occurs in relationship, which also means that healing occurs in relationship. And I want you as leaders to think about that, to think about your role in your relationships with all of the other varied humans that you interact with on a regular basis. And are you creating that healing, hopeful, honest, and trusting relationship to give people that place and that safety? Next slide. So if you haven't gotten it yet, being trauma-informed refers to everyone in your organization. It means that from your janitor to your security guards, to your front desk staff, to your administration staff, to your finance officers, and your board of directors, and your CEOs and executive directors, that everyone is involved in helping the organization be trauma informed. This next slide gives you kind of that progress. We need to recognize we're never going to hit being completely trauma informed. There's never an end. This is always a work in progress. And so as we move throughout, right, that process, we start usually in organizations, systems that are organized around trauma. And when they're organized around trauma, we see people operating in silos, being avoidant of issues, not having nuanced and textured conversations. We see a lack of vulnerability. Everyone's really kind of protecting their space. There are a lot of meetings after the meeting. People are very reactive. People are avoiding or numbing. The leadership feels much more authoritarian. Do what I say and just go do it, right? Whereas when we become a trauma-informed organization, we start to really develop a shared language that normalizes and addresses that impact of trauma and resilience on our clients and our workforce. Again, all humans. That we operate from that fundamental understanding, and on that understanding, we start to change our policies and procedures, the basic culture that supports all of our interactions. And then we move into a healing organization where we are no longer working intently on following that lens of being trauma-informed. It just becomes the way we do things because the culture has so absorbed these practices and principles as just a core set of beliefs in terms of how they practice all their interactions. Next slide. So this gives you an overview of the National Council for Behavioral Health framework of what it is to be a trauma-informed, resilience-oriented leader. And what you can see is that we've divided it into these 4 quadrants: trauma-informed principles, fostering supportive environments, adaptive leadership skills, and understanding the implementation strategies to really make lasting organizational change. So today what we'd like to do is focus on 2 of these quadrants, both the trauma-informed care principles and then a little bit about that rapid cycle CQI on the implementation strategy of how we can start to get these principles into the blood of our organizations. So on the next slide, we have this list, one more please, of SAMHSA's trauma-informed care principles. And when Joe and I were talking and preparing for this, Joe, if you want to kind of share your, kind of how you saw these coming together.
Yeah, is my sound better now? I tried logging off and logging on. Somebody give me a sound check to see if I'm understandable.
Much better, thank you.
Oh, good, good. Yeah, you know, it really is a progression, and it's of how we can come together and support each other. If we are safe, and we can talk about safety, or if we're not safe, but we can support as much safety as we can, then we can get to a place of having communication that builds trustworthiness and transparency. And that is really what we experience as peer support. Peer support is when we can talk about what's going on with ourselves in a way that's somewhat vulnerable. And that makes it safe for other people to be vulnerable. If I reveal, especially if I'm a leader, if I'm willing to reveal some of my doubts, some of my fears, and say, well, you know, I'm uncertain, but I think this is the best we can do now, and this is how I'm thinking about it, that builds support with the people we're leading to do the same with the people they're leading. And by sharing that much and allowing ourselves to be vulnerable, it really builds that loyalty and collaboration. Then we feel like we're more a part of each other's thinking. And and that increased understanding and making it okay to talk in that transparent way is empowering. If I feel safe to say what I really feel and think, I feel empowered. And I feel like I have more choice just because I can speak out. And in the end, that will help us with our long-standing problems, with gender issues, with racial issues, with political philosophical differences. It's when we hide how we really think and feel, or when we talk about how we really think and feel in a way that's not supportive and respectful with each other, which doesn't mean hiding and pretending you disagree with the other person, because in the end, they'll know you're not true and then they can't trust you, you know. It can be tough to disagree in a warm, supportive way, but that is the backbone of mutual collaboration.
Thank you, Joe, for pulling those together. So in the next series of slides, we have for you guys the definition of what these different terms start to mean, as well as a lot of examples for you as leaders of kind of where the rubber hits the road. I definitely know when I was in the field, and definitely my last position as a chief operating officer, the theory sounds really good, but then what do we do with it? How do we make this come alive in our organization? So when we're talking about safety, I want to recognize that here it identifies that physical, psychological safety, but it's also important that we're looking at social and moral safety as well. And as Joe was talking about it, right? Are we modeling safe and secure, environment? Are we creating that space where people can be present? Are we open to critical feedback? And do we share it in a way that's supportive and helpful? You know, are we mutually accountable? Do staff have the ability to give feedback to the leadership as much as leadership gives feedback to the staff? Working from those adaptive leadership skills, building on our relationships. You know, from a leadership perspective, Brene Brown will tell us, if we don't have compassion for those we lead, we shouldn't be leading them. This is about relationship and connection. The one thing that I want to highlight on the next slide is the area of moral safety.
Elizabeth,
you know, we've always been...
Let me stop and give a concrete example
Sure.
for a moment about how we do better and actually appear stronger by admitting as leaders our uncertainty and the difficulty of the trade-offs. I've worked a lot with hospital executives who had to manage their way through the surge of patients and the quarantines with COVID. And a number of them were heavily criticized and suffered morale and problems among their staff and fear and resentment when they did not shut down voluntary procedures as early as many of the staff thought they should. If you talk to them, they were very worried about that, but they were also worried that they wouldn't have enough money to keep the place open more than 60, 90 days. Because most of the money that keeps hospitals afloat are more the scheduled procedures than the ongoing emergency care. But they didn't share with their staffs that, oh my God, we project that we only have 60 days operating reserve. I don't know how we're, you know, if I shut this down early, I cut how long I can get. They kept it to themselves. So their actions were inexplicable and appeared morally indefensible to the staff because they didn't share their own fears and anxieties, and they thought the staff wouldn't be able to bear hearing that uncertainty. As a leader, they had to be silent and strong. And so that kind of led to the impression and actually increased some of the moral injury because of an unwillingness to share their own vulnerability and the tough choice they were making. I'm sure many of you can immediately understand the squeeze they were in. You know, do I keep doing procedures that could increase the risk of infection, or do I avoid the risk of having to shut down in 60 days? Horrible choice, which leads us to moral safety, which is hard.
Yeah, thank you. It is this difficult place, you know, and it's interesting to me, and I've had a lot of conversations with people about the second point, right? That not only do we need a space, right, to talk about hypocrisy, to talk about being asked to make choices that compromise our moral code, but also we need to openly struggle with that, as Joe's talking about, right, in the environment with people, that we struggle with the idea of and the concepts of honesty and integrity, because it's in that struggle and in that openness and that vulnerability that we can be human and work with each other. It's when it's reserved, when it's not safe to talk about it, that moral injury can really occur for our staff. And I will warn you, if we don't address things and your staff are falling in that space of moral injury, they will burn out and they will leave the field. And we don't want that to happen. So important that we're addressing this right now. If we can skip a couple to the staff culture, I wanted to give you guys a resource of one way to start addressing how to create a positive staff culture. And this is a way through, and I think the resource is on the end, but it's the Compassion Resilience Toolkit, which is a great resource for us as leaders and supervisors, because not only does it give you different sections to work on, they actually give you the handouts. They can show you how to show up and set up the meeting, right? So we don't have to reinvent the wheel in what we're doing. But this can give you a way to really ask, if this was the best place I'd ever worked, what would be the clear, identifiable 5 to 8 behaviors that everyone in our organization would be doing? And then we can lean in towards acting in that way. 2 over then. We also need to look, as Joe was talking earlier, right, about trustworthiness and transparency. This comes in, safety is in those relationships. So important, right? And these are different ways in which we can really do it. And making sure that we're not talking about them, right? We're talking about us, that we use that inclusive language, that we actively address conflict in a supportive way to get to the other side. We recognize that conflict's going to occur and be comfortable in that space and help people walk through it to the other side. You'll also see reference to Brene Brown's clear is kind, unclear is unkind. All of your staff show up every day, right, with the intent of doing the best that they can. And we as leaders need to not only remove barriers, but we also need to give them the skills and give them the tools to be successful. So if we can be clear about what the outcomes are going to look like, then they can be clearer about how to get there. Next slide. So these just give you some other ways. It's like how are the peas being boiled? If we remove the outside so that we can really see everything that we're doing and trust our staff, as Joe was saying, with difficult information. They can handle it. They just need the information. The next slide talks very briefly about Patrick Lencioni's 5 dysfunctions of a team. I really just wanted to highlight for you that the absence of trust is the first thing that's the roadblock, right? So it's so important that we have that in everything that we're doing. Next slide. Joe talked about peer support. In the trauma-informed, resilience-oriented world, we mentioned this in kind of 2 phrases. We talk about the idea of nothing about us without us, and doing things with people, not for people. So how do we engage the voice of lived experience in everything that we do? We talk about your clients being the experts in their lives and also in your services. And so how do you bring them in on all levels of service delivery, policy and procedure review, interviewing for new staff and hiring practices, so that their voice is completely included in everything that we're doing? And that gets us also to that collaboration and mutuality, right? The idea that we understand at the end of the day, next slide, that there are certain leaders in certain positions who make the final decision. But we want to really give our leaders and ourselves the best opportunity to make the best decision for everyone involved. So the more information you guys have from everyone across your organization in terms of the impact, the better decision you can have about how to do things and move forward. So when you're doing your brainstorming sessions, when you're in your committee meetings, you really shouldn't be able to tell who's the CEO and who's the janitor, who sits at the front desk and who's the therapist, because we really should have that collaborative, mutual feel that everyone's input is important, everyone is respected, and everyone can feel that they can share equally. You can see at the bottom, right, that shared decision making. Next slide. So this is what it looks like, right? Next slide. The other principle, second to last principle, is that empowerment, voice, and choice. When trauma occurs, we lose our voice. We lose a choice over things occurring to us. And so it's so important for all humans that where we can infuse it, we put it in. That we allow people to determine the trajectory of their professional development, the way in which they go about doing the work. We hire really smart people. We hire incredibly creative people. And we need to give them the space to bring all of that richness of themselves into the work that they're doing. You can also see in here trauma-informed supervision, focusing on wellness-oriented staff worksheets, right? Providing information about how trauma impacts us in your waiting rooms and to your staff. Next slide. So these are other ways, open forums, and really focusing on that idea with people about not doing things with them, or not doing things for them, but with them. So with us, not for us. And even bringing the spirit of motivational interviewing into your supervision. It's not just an evidence-based practice that we want to use with clients. Clients are humans, right? So how do we do everything from this human perspective? And then our last principle from SAMHSA, right? Cultural, historical, and gender issues. How do we recognize the impact of historical trauma, systemic racism and oppression? The things that have happened to people in their communities before they've even entered the room of our services or our supervision room, and make sure that we are being a socially just organization. We can't be trauma-informed and socially unjust. They go together. So making sure that all of those things are really highlighted and leveraging the power and relationships that we do have to continue to move these things forward. The last couple slides that we have here for you are about really understanding implementation strategies for organizational change. We use Cotter's model. If you can go to 2 slides for me, Casey. We use Cotter's model, but there are other models out there. You know, when we go into our field, we go into school and we learn about our field and how to practice our field best. But there are actually there are multiple theories and practices on how to change organizational cultures with sustainability in mind. We've been so involved frequently in the latest and greatest. This is the new phrase. Here's the next thing we're going to do. And before we've even finished that, we're sending staff to a new training, right? We want to make sure that when you're transitioning to a trauma-informed, resilience-oriented practice, that you do it with sustainability in mind. And so walking through purposeful change management is going to be really important as a leader, that you have that process in mind and that you walk through those steps. When you're doing that, on the next slide, we want to infuse and give you the opportunity to really practice quality CQI, right? That continuous quality improvement. So we've actually got 3 different formats in which you can use to help you identify what works best for you and your organization. So this first one focuses on focus, right? So finding that problem, identifying it, organizing your team around addressing that goal of improvement, clarifying as you go through that process, understanding how your organizational processes and practices and policies, and even the people in those roles, how those impact the work and getting to that improvement goal. Are they roadblocks or barriers, or are they assets in terms of achieving it? And then selecting your strategy that's going to work. Once you do that, I want you to go to the next slide and really look at this plan, do, check, act process, or PDCA. So you want to plan that your steps, right? Who's going to be involved? Who's going to be impacted? When is it going to happen? Where is it happening? How are we going to measure it? We really want you to be data informed, right? Not just try something and say, it felt like it was good, right? How do you have really solid data behind what you're doing so that we can make sure, right, that you follow a process and can learn from it? Do it, implement it, try it, lean in, be vulnerable, try something new and different. And then check it. Did it work? Where are we on our metrics? Did we move the needle? Did it move in a different direction that we didn't expect? What can that data and those outcomes inform? And then I want you to act based on those findings. Do it again. Get back to your plan and those implementation strategies and keep walking through that process to improve everything that we're doing. So when you take any of those ideas on the previous slides for our trauma-informed, resilience-oriented principles, see if you have the impact with staff or with your clients that you wanted to have. What can you learn from trying something differently? And then move on through that process. And right now, with the upheaval, is a really good time, as Joe said in the beginning, right? Crisis has that opportunity, and this is that opportunity for you to maybe move along some initiatives faster than what you thought you could do previously. And then the next slide just gives you kind of how do you identify what a good measure and improvement strategy might be. And we really want to make sure that it's practical and something that you can implement, something that affects a lot of people, isn't overly expensive, right? And that you have those tools and resources available to your staff. You also want to kind of watch those ripple effects. What are the other unintended consequences, positive or negative, when we start to shift things? Next slide. And then just that understanding of the basics, right? In a trauma-informed, resilience-oriented organization, all staff, all humans who are impacted by that system must be empowered to be able to speak up and identify problems. We as leaders aren't always close enough to it to recognize where those ripple effects are or what's really going on the floor. So how do you engage all of your staff to be willing and open to bringing that information forward? And the solutions. Our staff are incredibly creative people. We want to tap into that as much as possible. We want to work together to determine what those root causes are and come up with possible solutions. Like back to that data, right? We want to make sure that we're tracking it and we have some information in those feedback loops that aren't always as, driven by personal opinion or, individual impact. And then absolutely learn from those failures and celebrate your successes. I tell my children all the time when they play sports, we learn absolutely nothing when we win the game. We learn when we lose. So we have to be vulnerable to try different things and know that part of success is failure and embracing that with all that we do. The last couple of slides we have here for you are that journal that we talked about last time. And then that keep, change, start, stop process that we did at the beginning. What are we doing really well that we want to keep doing? What if we change or adjust, we'd be doing even better? What do we want to add into our practices? And what do we want to stop doing because it's just not helpful? Joe, I'll turn it back to you for the last couple of words.
Yeah, so again, I really want to thank you all for the work you do for your communities and for how you have helped them through the epidemic and how you'll be helping them in the future through what remains of the epidemic and also through the health threats of our current social dialogue and unrest. What you do is important and you are important. And we hope this is helpful to you. And we look forward to working shoulder to shoulder with you to keep people healthy, get them healthier. Thank you so much.
Ava, are you still with us?
Yes, I am. We want to thank you so much for a great session.
And then our next one coming up is on complex trauma at the beginning of October. So we will see you guys then.
Look forward to it very much. Stay well.